Mend is a national programme that we deliver in Northamptonshire to tackle child obesity and unhealthy lifestyles. Mend stands for Mind, Exercise, Nutrition, Do It, and it's a healthy family lifestyle programme that lasts for 10 weeks. Families and children benefit from the programme because after the 10 weeks we invite them back to take part in other activities that we hold. The children become Mend graduates and can go on to become Mend champions and be ambassadors for Mend in the county and possibly nationally as well.
You have to switch your kettle on first.
When Lara was younger, she had a couple of problems at school. She was asked if she'd like to attend Mend, and she said yes, and it's helped her out since then.
When I go to Mend, we start off with speaking about nutritional stuff and what's good for you and what treats you should have. A
couple of Mend people take the children outside to play activities and stuff like basketball, football or tennis or whatever, and then that gives the parents half an hour or so to speak to the Mend people themselves, and you just express your opinions and everything else, and you also learn more.
I'm a Mend champion now because I've been going to Mend for, I think it's like 4 or 5 years now. I help people out that are new to Mend and don't know much about it. If I didn't go to Mend, then I wouldn't have any confidence to do stuff that I do now.
For children and families that have been through the Mend programme, hopefully they've become more active and taken on board the healthy messages, take it through to their teenage years and into adulthood to ultimately make us a more healthier county.
Time banking is a way for people to share their skills and build up social networks and be rewarded for it in time. We match suitable participants and we arrange the exchange to happen. For every hour that they give, they get 1 hour back in credits, and it's lovely because 1 hour of ironing is equivalent to 1 hour of graphic design. We would like to think that we could roll this service out county-wide so people could benefit from this fantastic service.
I first came across Time Bank from the newspaper and I wanted to contribute to it. I helped a charity move from one office to another office, moving loads of furniture. I've done leaflet stuffing for carers in Northamptonshire.
I first heard about Time Bank through my local GP. It was one of those things. I was very nervous. I lived on my own. I rang up and met Nicola in Western Fable Library. I've done photographs for a lady from South America. I've taken photographs at the lunchtime do's. Kate will ring me up. Have you got time to do this, do that? I'll have a go at anything.
We also organise cinema trips where we all meet up together. We have meetings, you bring your own food, you share your own food with everybody else, which is brilliant.
The difference it's made to me is I've got more confidence. I can go in a restaurant, I could go in a pub. Prior to coming to Time Bank, I found it ever so difficult.
It's allowed me to get out more and I feel wanted, which before I didn't.
My name's Stuart Mould. I'm 58. I received a head injury in 1979 from which I never really fully recovered. Unfortunately, 30 years after the event, it was found that I had pre-senile dementia. I'm working with the young people's dementia team at Rushden Hospital, and one of the nursing consultants put me in touch with the Creative Showcase exhibition. I'm not a trained artist. I just try things, and if I like it, that's fine. It seems to relax me, and you seem to get lost in the process of painting or drawing. It's quite calming. I suppose it does give me a bit of a buzz to hear what comments are made.
I've been using mental health services in Northamptonshire for some years, and I've had reason to use the complaint system, which wasn't always very good. So when I was invited to become involved as a service user governor, I became a member of the trust and used the opportunity to improve the services. I think the hardest part of being a governor is the business part. It involves about 6 big meetings a year. We have subgroups that meet every couple of months. I'm on 4 subgroups. I've met people of all levels. I've met service users who use the church drop-in services. I've also met people who are receiving very good services, and when they're able to tell me that there is a good service, that is the payback for me as a service user governor. People like me are very necessary service users because we know what the problems are. We see the problems firsthand, and it affects us in our daily lives. I'm very happy being a governor. I find it very fulfilling. I'd like to carry on being a governor. I'd like to see through this current climate of change, financial change, and I think it's more important than ever that service users' voices are heard.
No, you take care. Bye.
Any patients, carers, staff of Northamptonshire Healthcare or the public of Northants can become members. Members receive information about the services, can vote and have a say in what is going on, as little or as much as they choose. The more trust members we have, the better people will be represented.
Patients have to be right at the centre of what we do. What we realise is that actually patients know the most about their conditions. They know what it is that they need to help to support them to have the best health that they possibly can. We have to work with patients, learn from patients, and actually shape our services so that they get the best experience, they get the best support they can, but in ways that suit them, where and when they need those services.
I found an awful lot of confidence with Time Bank.
It's helped me to meet other mums.
I got listened to by staff. The staff were very nice.
Intermediate care team have given my life back.